All right, you guys, I am Dee with Lilux Aesthetic Medicine and Training Institute, and I am here today to tell you about some insider knowledge, some secrets that are kept quite well hidden in the industry of aesthetic medicine and hidden from the public for very good causes and very good reason. And I'm going to spill all those secrets today because I believe the public has a right to know, and you need to know to be able to make informed decisions and to avoid horrific outcomes. So, do you know or have you ever seen one of those women that is so well put together? They have impeccable nails, beautiful makeup, their hair is just perfect, they're always super well dressed, but their face looks like it's melting off their bones, right? So that is unfortunately the outcome of very poorly performed aesthetic medical treatments, okay? And there are reasons for this. Today I'm going to talk about three in particular, but I'm also going to give you some tips and tricks embedded in these three that will act like red flags for you so you can better determine where you want to receive your procedures and not to be scared of Botox and dermal filler procedures or any aesthetic procedures, because truly, if they are done correctly, they are done by the right injector, someone who's actually trained properly and educated and understands the science behind these procedures and the products we're using, that you will achieve a beautiful and revitalized, gorgeous outcome without looking like your skin is falling off. And I can promise you 100%, if you pay attention to what I'm about to tell you and you do a little bit of asking questions yourself and investigating before you jump into someone's chair, you will always be happy with the outcome. And aesthetic procedures are not something to be fearful of. So, the very first reason this happens is a business problem. And the problem is that people assume that the fancier, more beautiful med spas are going to provide a better outcome and a better service. You know the ones. They are beautiful, they have really catchy names, they're large. Med spas are very expensive to run, very expensive to get licenses for and insurance for. These are pricey businesses to operate, okay? And I operate one. I run one, so I understand the cost and I understand how it works. And it's a lot. It's a lot. So you see these big beautiful ones, and you walk in and someone takes your coat and maybe you're handed a glass of champagne or a drink, and you're seated in a beautiful, well decorated room, and not much assessment goes on. What goes on is a lot of, what would you like done today? And what you would like done today is your wish at their command. Most of the time, they will do it. And that is a red flag, because a lot of times I have found when conducting assessments with clients is that what they want, the outcome they're looking for, isn't necessarily going to be achieved by the procedure they think is going to achieve that. And sometimes the structure of their face, their anatomy, their facial balance, the strength of their muscles, their bone structure won't allow for the outcome they're looking for. Sometimes they want really large lips, and they are starting off at baseline with almost no lips at all. Well, I'm not going to throw 2 syringes of lip filler into somebody that has no lips immediately. That takes time, and that takes some patience from a client. You need to start someone with a lower level, a lower amount of dermal filler, and keep that natural shape and natural border of their lips, so you are enhancing their lips, not pasting some new lips onto their face. And that's a big difference. Anyone who is willing to take somebody from zero to, I want these really large lips on this picture on Instagram, and the injector says, okay, let's do it. 2 syringes or 2.5 syringes, let's go. That is negligence, and that's how you look like you've got someone else's lips glued to your face, and that gives the face melting off effect. The other part of this business industry, and sorry, to finish up on that, is that just because the building is beautiful, the service is high end, and you think you're in a really high end place, so you expect really high end outcomes. They're completely unrelated, because the reason the building is great and beautiful and it's a beautifully manicured location and it's very aesthetic is because the owner is probably the medical director, which is either a nurse practitioner or a physician or a plastic surgeon or somebody who owns the business, and they've got some dough, they've got some cash, and they've invested in that. But that isn't the injector that's injecting you. The injector injecting you is whoever they could hire. And if we're thinking with a business mind here, they're not hiring the most experienced, highly trained, master level injectors and expert injectors if they're paying big bucks for their location, because that's just really costly when you can hire a fresh new injector right out of school and you're not really sure how much experience they have, how much education they have, what they were educated on. I know some education programs where injectors are brought in and they learn a little bit of basic anatomy, and mostly they learn about brand name Botox, a few brand names of dermal fillers, what to watch out for, the risks, the drugs that treat the risks, not how to use them, just the drugs that treat the risk, the name of them. And you get maybe one injection or two injections of practice, and you get your license and you walk out the door and you're a nurse injector and or a physician injector, when it takes a lot more education, a lot more scientific understanding and chemistry, understanding of the chemistry and the physics, the anatomy, the physiology behind the human body and how it works, how these drugs work, the science behind the drugs, the manufacturing, how they're composed and who develops them, where they're produced. All of this information matters, and a new injector just isn't going to know all that because it takes time to get there. So that's where it's up to you as the client to ask a lot of questions, make sure that injector knows what they're doing, and if they don't, they'll have a few minutes to go and look it up before they touch your face. And that's a safer bet than just jumping in their chair and saying, yes, big lips, and that's what you get. So that is one of the reasons people will assume and make the assumption because a place looks a certain way or because they have the most beautiful advertising campaigns going on and they spend more time videotaping procedures than they do looking at the face of the person they're performing the procedures on, that they are gonna provide the best outcome. And that just isn't the truth. You are looking for expert level injectors, not not the Trump ballroom of aesthetic medical med spas. Okay, if I could put it in any funnier, amusing way. Okay, the second reason is due to false advertising and misleading unethical practices, and this is with relation to Botox. There are two things that come into play here. First of all, a lot of places will advertise $5 a unit, $5 a unit. Well, let me tell you, Botox is very expensive. It's a very expensive product to buy. If you're buying it, that is Canada approved. It is made in Canada or the US, and it is regulated, and it's not bought online from a country like China or and shipped in internationally, which a lot of places are doing to get really cheap Botox. I mean, you can buy Botox online called Inatox, and it's deadly dangerous. It's not regulated. You don't know the concentration of toxin per unit, and there are people paralyzing themselves by injecting Botox on their friends and at low end places. And not low end because they're not fancy, low end because they have really unethical business practices and they're willing to buy products off the internet and not to buy the three brand names. And I want to tell you, you want to stick to Botox, Dysport, or Xeomin, okay? And the reason is because those are safe, they're Health Canada approved, and you will get a standardized result. There's a caveat to this though, and I will get into that. And that's in my point 3. And that's about the science behind it. But point 2 is one of two things are happening. To be able to offer $5 units, when Botox is so expensive and clinics are paying so much just to be able to function, the clinic would have to be buying your product for you. Not only are they not making money, they are losing money. They're going into the negative, and they are performing procedures at a loss, at a financial loss. And I don't believe that's happening at all. So the only two ways to explain that are either really cheap products that's being shipped in from other countries that are not our quality and our standard of quality in Canada or the US, or they are watering down your Botox and we call it reconstituting. And what we do is we mix bacteriostatic saline 1.1 mils with our toxin, which comes in a powder in a vial, and that is the correct mix unless you are hyper diluting depending on certain situations or in certain procedures, or under diluting depending on certain situations and procedures. And again, this is where the knowledge and experience and expertise needs to come in, and it's something that not every injector knows about and is aware of and studies and makes it their business to learn. So they are watering down Botox for one. And I know for a fact there are places in my community even in that are watering down Botox. I know it, they know it. This other aesthetic medical clinics in the community know it, but there's nothing you can do about it. And the other thing is how they will tell you they're, for instance, giving you 10 units of Botox in the forehead and 15 units in the glabella area, which is standard 5, 5, 5, and 10 units across the forehead. Except when they draw up their 10 units across the forehead to give you, and they're charging you for 10 units, it looks like this or like this. And this is how small the units are, right in front of the camera. I don't even know if it's going to be able to focus in on that. But that's just at about 5 units. But when's the last time, if you received Botox, you got up close, real close, and looked at how many units you're receiving? Because these needles, really little. Units are really minuscule. They're very, very, each unit, I don't even know if you can see it. It's so small. Is a little dotted line on this needle. It's very, very tiny, and this is what we use to inject Botox. And a unit is, I'm going to show you what a unit is. That's 1 unit. 1 unit. And it is at the tip of where you see the black line. Not the bottom black line. That's the base of the plunger. The tip of where you see the black line. The top of it. That's 1 unit of Botox. So they could be telling you you're getting 10 units, charging you for 10 units, and giving you 5 units. And that's how they can afford to offer you $5 units of Botox. So there are no deals in aesthetic medicine. You get what you pay for. And that's something really important to remember. If someone's offering you something $5 a unit, they're either paying for your Botox for you because they're just that kind and lovely, or there's something funny going on and you need to go somewhere that's charging enough to cover at least the price of the product, and hopefully a little bit more because you want your injector to be making money and not be like performing slave labor. Right? Doesn't make sense. So that is the second point. And that is super important and something you need to be aware of. So, I don't know. Maybe I would ask, when they draw it up and they come at you with Botox, can I see that needle? Can I see how many units you have? Can I see what it looks like? Because it's really hard to determine because Botox is clear. So, I mean, whether the needle is, it could even look like it's at 15 units here. And then and you don't see the difference between what is oxygen, air in there, and what is Botox. And I show it to you and it looks like 15 units and you see it, But as I get close to you, I just eject the air, and there's the 7 units you're actually getting. So there's no real way around that. The only real way around that is to recognize that if somebody's offering you Botox for $5 a unit, $7 a unit, they're not even making enough to cover the product, and that is wrong. Something isn't right, it's not ethical, and there's dirty practice going on. So don't get involved in that, and don't let them touch your face. Don't let them touch your face, because it's not going to work out well for you. And the third reason, sorry, I'm into units here, is the difference between products. And I want to explain to you, there are different products when it comes to Botox and fillers. I'm going to talk about fillers first. So with fillers, I use all the products, but you'll see certain med spas you go into, and for instance, they will only use Dysport, and they'll only use like Juvederm or Restylane or certain products, like certain brands of dermal filler and Botox. And that's because they make brand deals with companies and they get a discount. So they're buying the product for cheaper and they get a discount. But the problem with that is that not every product is right for every patient. Depending on the patient, the product has to be altered, or you need to use a different product. For instance, I have learned by using a variety of different dermal fillers that I have my favorites. I have my very favorite dermal filler because I love the shape of the molecular structure of the filler. I love how that molecular structure contributes to the way it fills lines and deep creases, and how it also will rest deep on the periosteum, so just above the bone, and provide elevation and lift to the smaz and to the tissues above it, and really fill out creviced areas like the nasolabial folds or deep hollowed under eyes, or provide lift and give you that cheekbone enhancement, or correct a jaw with jowls and give you a nice snatched nice jawline and chin. And for lips as well, I like a different product for lips. And there are some products, for instance, there's one that is considered to be a superior product, but I've found that the needles that come with that product for us to use are very, very slim, very long, and very sharp. And the angle of the needle, which is called the bevel, for some reason, the angle of the bevel of that needle really causes patients to bruise. It has a tendency to cause a lot of bruising. So if I have maybe a more elderly patient, or a patient who will report to me that they bleed easily, or if I'm doing an area which bleeds easily, like the mouth, for instance, our mouths, and if you have kids' mouths, when they bump them and knock their mouth, split a lip, mouths bleed. I'm not going to use that product because I know that that needle really isn't conducive for somebody who is prone to bleeding, or who I know is getting an injection in an area that is high risk for a high level of bleeding. So you need to know your products. You need to know which ones are best for what procedures and for what patients. And that all comes down to providing a really good assessment, not jumping in a chair and the injector saying, "What are we doing today?" and you telling them and them saying, "Okay, let me get the stuff." And that's that. Don't let their brand deal be your bad outcome. Okay? Make sure you go to a provider that offers a number of various brands that can tell you why they want to use a particular brand on you, and for whichever procedure you're electing to have, and why they feel that brand is best. And they need to know that history and that background. And when it comes to Botox, Dysport and Botox are pretty even. I like Dysport better than Botox. Most people do. Dysport is one of the ones that does a lot of brand deals with people. You'll see Dysport signs everywhere in med spas, and they'll only use Dysport. But the problem is, Dysport is one of those. There's only really those three: the Dysport, Xeomin, and Botox that we use. You can become resistant to it. So if you are a long-term user of neurotoxin and tox products, for Botox purposes, then that might not be the best option for you. And let me get into a little bit of the science behind neurotoxin to help you understand why and why this is so important for you to achieve a really good outcome. So, Xeomin is often considered a better long-term neurotoxin option for some clients because of its lower protein load and lower theoretical risk of antibody formation, especially in patients receiving repeated treatments over many years. So the clinical reason behind it is this: Xeomin is a naked neurotoxin, unlike Dysport and Botox. It containing only the active neurotoxin molecule and does not include the accessory complexing proteins found in Dysport and Botox. Because with repeated exposure over many years, patients can end up with neutralizing effect, reduced response, partial or complete toxin resistance, and this is called secondary treatment failure and immunogenic resistance. The theory is that the additional proteins in Botox and Dysport add a contributing factor that makes the immune system hyper respond to it, and the immune system will fight it, giving you only partial benefits. And Xeomin can be particularly useful in clients who are treated for many years, younger patients starting toxin early, patients requiring high cumulative doses, hypermetabolic clients needing frequent treatments, and patients reporting Botox not working like it used to, which we've all heard. Patients will say, like, it's just not the same. I need more. I need you to top me up. I need more Botox, and they need it too soon. But really, it's a resistance building to the proteins that are on the Dysport and the Botox, whereas Xeomin has none of that. It is the naked toxin, or neurotoxin. So for certain clients, I like to use Xeomin, and that is cost efficient for clients that I know that because they're not going to spend hundreds and hundreds of dollars on so much tox because they're trying to achieve a result they achieved 3 years ago by adding more and more units to their normal procedure, to normally what they would get. For instance, 4 years ago, they'd get 40 units for their face, and now they want 100 units for their face. Whereas with Xeomin, the 40 units will still work because your body doesn't have a hyper immuno response to it, and it's going to work over time. You're not going to become resistant. You're not going to become immune to it. And it's going to continue to work at the same dosage level, saving you money, saving me money, saving you having an immune response to something going on in your body, which nobody wants, that increases inflammation in cells and all sorts of things. And that is just a little bit of the science behind neurotoxin. Now, I can tell you, if you are someone who is receiving Dysport when you have already this resistance, you're going to be going back more often. You're going to get partial results. So maybe one half of your face will be effective and the other half will be hanging and wrinkling and looking horrific. And that's going to be your outcome because you've developed resistance. And the injector will, when you come back and say, look at this, what's going on here, we'll just say, okay, well, we'll just give you more. Or, we'll just give you more. We'll add to it and then charge you another $300 or whatever. And instead of saying, you know what, you are becoming resistant potentially, let's try using Xeomin and we will see how that works out. And that is the knowledge that comes with experience and expertise and having an expert level injector and not someone new that's just going to use Dysport because they have a brand deal at their spa and they get Dysport cheaper because they have a brand collaboration. Okay? So you want someone who's working independently of brand collaborations, doesn't have any responsibility to sell a certain particular brand, and has that independent freedom to provide you with procedures using the product that's the best fit for you, that's the best product for what you need for the procedure you're having done and for your overall anatomy and physiology and the outcome you want to achieve. So that's it. I'm not going to drag it on any longer. Those are 3 reasons. I've given you some red flags, things to look for: really cheap Botox, really fancy spas that spend or that have crazy marketing and advertising or videotape every single thing. It's more about, it's like you feel like you're walking into a photo shoot and you're really just going to get a little Botox on your crow's feet because they're more concerned about capturing it for their advertising and Instagram and than they are about really doing a great assessment on you and treating you like a patient receiving patient care because you are undergoing a procedure. And although it is medically non-invasive or least invasive, minimally invasive is the name. It's minimally invasive. It's still a medical procedure and you need a medical assessment and a really good one. So jumping in the chair and saying, "What are we doing today?" is not acceptable, not good enough. Jump right back out of that chair and chug your glass of champagne and head back out the door. And those are my tips. And I hope this is helpful for you. If you have any questions, DM me or send me a message or visit my website. You can leave me messages there or get in contact with me and I will answer all questions. Leave me a comment on this video and I will respond to all comments. And I look forward to hearing from you. And I hope this was valuable for you guys because it was a long video. And if you stuck to the end, subscribe to my channel and enjoy because my videos are going to tend to be longer when I make them because they're educational and they're going to be informative. And I'm not trying to sell you something. I'm trying to help elevate this industry and make the public as aware as the industry is. And I want you to be informed and knowledgeable before you ever engage in receiving a treatment that you don't know everything about that you should. That's all. And I want you to enjoy aesthetic medicine because it's a gift. It's amazing and it can do wonderful things if done by the right person at the right time and the right way with the right drug and the right dose. And that's all. And those are the rules of healthcare. It's the rules of healthcare, literally. And it is what it is. So that's all for the video, guys. I hope you have a fabulous, fabulous evening.